Hi, my name is David Emerson, and I'm a long-term myeloma survivor and myeloma cancer coach. Welcome to the vlog blog regarding MRI scans in multiple myeloma. First and foremost, imaging studies are central to the life of all multiple myeloma patients going forward. Yes, blood work, your blood studies are also important, and you'll be stuck, prodded off and on for the rest of your life. It's been 25 years for me, and I get tests done, not as often as I used to, but regularly. The issue is of the 4 different basic imaging types of imaging studies: MRI, CT or computed tomography, PET scans, positron emissions testing, and good old-fashioned x-rays. All have their place in multiple myeloma. The issue is for you to think, for the patient to think through pros and cons for each. 2 of my main hot button issues when thinking about any therapy or any form of diagnostics are A, cost, and B, possible side effects. In the area of cost, you must understand if your health insurance covers it. If you have a high deductible, do you pay it? Do you pay a percentage? Have you used up your deductible so far this year after 6-8 months? Those kinds of things. What you pay, obviously x-rays, as an example, are cheap. Tens of dollars. CTs, PET scans, when I did them, were A, beneficial, important, but B, extremely expensive. Discuss this with your oncologist. Call your insurance, your health insurance company, figure out what costs what. You'll be glad you did. Side effects. In the case of MRIs, there's what they refer to as a contrast agent. Let me see if I pronounce this properly. Gadolinium, contrast agent, gadolinium, white stuff, to shoot it into your veins. Yes, it makes for a better, easier to read MRI. However, studies confirm that gadolinium enhances or exacerbates, feeds multiple myeloma. That is bad. Last time I had an MRI 6 or so months ago, I simply told the technician I don't want the contrast agent. I didn't get into my cancer or myeloma. I didn't get into any of that stuff. I just said no. Not a problem. So, MRI, it's excellent for determining the bone involvement at the very, very beginning, before, I think, pain and fracture and those kinds of things. So MRI is essential, and MRI, magnetic resonance imaging, is essential. No radiation. Yes, when you have an MRI and they shove you into that tube, it's disconcerting. The Cleveland Clinic, where I go, you can listen to music. Frankly, I'm a coward. I close my eyes. So I listen to music, close my eyes, and the MRI is over with before you know it. It takes some time, but all I'm saying is MRIs are excellent for the myeloma patient, depending on cost and denying the contrast agent. There's a study below, scrolling down the page, talks about gadolinium. Read it for yourself, excerpted. If you want to ask me a question, watching this on YouTube, look for the link to People Beating Cancer, click it, post a question for me, I'll get back to you ASAP. If you're watching this post on people beating cancer, scroll down, ask me a question. I'll get back to you ASAP. I appreciate your time, and be well.